to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today's show with Katlein França. She is a dermatologist. She wrote the Kevin MD article, Want Your Skin to Look Better? Then Consider Your Mental Health. Katlein, welcome to the show.
Thank you so much, Kevin, for having me here.
So we'll get into your article in a little bit. First off, just briefly share your story and journey to where you are today.
Absolutely. I'm a dermatologist and I specialize in psychodermatology. I am an assistant professor at the Department of Dermatology and Cutaneous Surgery and also Psychiatry and Behavioral Sciences of the University of Miami Miller School of Medicine. And I'm currently the director of the Psychoneurocutaneous Medicine Center of the same university.
So I have to admit, I don't know too much about psychodermatology. Tell my audience a little bit what that is.
Well, this is an emerging subspecialty of medicine that combines the fields of dermatology, psychiatry, and psychology. And is here, to offer traditional treatments, but also complementary treatments with scientific evidence for patients suffering from skin diseases.
All right. So walk us through a typical day in your exam room. Tell us an example of some of the cases you might see as a psychodermatologist.
Well, there are many skin conditions, for example, psoriasis, vitiligo, or acne that can impact the mental health of anybody suffering from those diseases. So the daily life of a dermatologist, we see many of these common skin disorders and many patients that are, psychologically impacted by them. And we also have other psychiatric disorders that can have manifestations in the skin. For example, you're talking about obsessive compulsive disorders and spectra such as skin picking, trichotillomania, where the person pulls the hair out, or nail biting, and other diseases like delusional diseases that can manifest in the skin. For example, patients that have what you call delusions of parasitosis, that they might have this false belief that they have the skin infested or infected by parasites.
Now, what kind of training do you need to become a psychodermatologist? Do you become a dermatologist first and then do a psychiatry residency? So what's the training involved to become a psychodermatologist?
There is no official, program in the United States, and there are a couple of certifications available now in Europe, but there's no official fellowship training program to train psychodermatologists. So we have few persons practicing in the United States. So basically we have different backgrounds. I am a dermatologist, for example, and then I did a PhD in psychology. Mm-hmm. And obviously I have this interest in the field. So I've been performing research and teaching and participating of many meetings nationally, internationally. Mm-hmm. So I can always update myself. But we do have colleagues in the United States who are, dermatologists, then did a psychiatry residency, or they were psychiatrists before, and then did additional training in dermatology.
Now, you mentioned, say, something like psoriasis as a typical case that you would see. So take us into your exam room from the lens of a psychodermatologist. What kind of issues will come up, and how would you approach a patient like that?
Well, you see the psoriasis, it's a chronic condition of the skin, and gladly we have many, treatments available nowadays that can help the person to improve the skin. However, you see that this disease often cause mental health issues. So these patients, they often suffer from anxiety, depression, stigma. Some people might have this false belief that the disease is contagious. So we have, many patients that have specifically, more particularly these more extensive cases of psoriasis. So we need to address the mental health problem, So very often these patients, they need additional psychotherapy and sometimes antidepressant medications that is going to help, for them throughout the dermatological treatment. Obviously, we're going to be providing them the mainstream treatments with medications, but we need to address the mental health issue.
All right. And you talk more about that in your Kevin MD article. It's titled, Want Your Skin to Look Better? Then Consider Your Mental Health. Now, for those who didn't get a chance to read your article, just walk my audience through it and share the story of why you decided to write it.
Very good. Thank you so much. That's a great question. So the article, Want Your Skin to Look Better? Then Consider Your Mental Health, was written with the goal to increase the awareness of the field of psychodermatology. And the goal was basically to make the public and other physicians aware of the existence of this emerging field that, as I said before, combines dermatology, psychiatry, and psychology. And also, how patients can benefit from taking, having a consultation with a psychodermatologist. So over the last 2 decades, there are numerous studies linked emotional stress, depression, and anxiety to many dermatological conditions. And we know that this repeated exposure to psychological or environmental stressors can have long-lasting effects on the skin. And also stress, can release hormones such as cortisol and adrenaline into the body, which can cause inflammation and make the skin more reactive and lead to different skin diseases.
Now, you mentioned that this is an emerging field in the United States. Just give a sense of how one can go about finding a psychodermatologist.
Well, nowadays there is an association called Association for Psychodermatology Medicine of North America. They have, some in their website, they can guide you. You can find some local professionals, that are people that are practicing psychodermatologists. Then you also, can reach out to your community to see if there's any psychodermatologists available. Usually dermatologist offices are able to guide you, or if they don't practice officially psychodermatology, most likely they'll be able to refer you to a psychologist or a psychiatrist that can work in conjunction.
Normally, there's a stereotype about dermatologists that they're able to see a lot of patients during the day and their office visit times are a little bit on the shorter side. That's the stereotype that a lot of dermatologists have. How much time do you spend with each patient during the day?
That's correct. Since we have this dedicated space, which is a psychoneurocutaneous medicine center, I am allowed to have 30 minutes, sometimes 45 minutes with the patients as needed. I know that's not what happens in daily life of dermatologists, but this is what, what we psychodermatologists ask, because this is the time we require, with each patient, and sometimes not even enough to address all the concerns. So, in our office, we have that privilege of having more time.
Now I'm going to put you on the spot here and ask you to tell me a case study, a story, a success story of, it could be a hypothetical patient, but I really want to kind of paint a picture of psychodermatology. Tell me a success story of a patient who came in to see you, what you did, and how you helped them.
Well, I think, many psychodermatologists encounter cases of patients believing that they have, parasitic infections in the skin. Some of them have seen many other providers before, and there is no real, parasitic infection when you examine the patient. That's a disease, called delusions of parasitosis or pseudoparasitic dysesthesia. So, I haven't seen many patients with that condition, and I think you need to first have a very good doctor-patient relationship. The patient must like you, so so you can guide the patient through the process. That disease, once you see the patient and you exclude causes for that, like physical causes such as medications or other conditions, other neurological conditions that could be triggering those symptoms. If you don't find any of that in the screening that you perform with the patient, we often tend to prescribe these patients a low dose of antipsychotic medications, and that can help, their nervous system. And these delusions usually goes away with, with a low dose of antipsychotic medication. So I had, treated a couple of patients, follow them through this journey. And it's very nice to see how much they improve, some of them in a short period of time once you give them the right medications. And there are other patients that just, we could find a physical cause for their problem. And once that was treated or addressed, those sensations of parasitic infections just went away.
We're talking to Katlein França. She's a dermatologist. She wrote the Kevin MD article, Want Your Skin to Look Better? Then Consider Your Mental Health. I'm a primary care physician. I do internal medicine, and I don't quite have half an hour with each patient, but I have 15 minutes, and typically I do get patients with initial presentation of whatever skin condition. Now, through your lens, what kind of questions could I ask them in the exam room that can perhaps uncover a psychological ramification of their skin condition?
I think you just start with a basic question, how do you feel? Is this impacting your life? How's your sleep? How's your quality of life? Are you exercising? Do you have, pleasure in your daily life? And I think just those basic questions can give you an idea of how much that skin disorder can be impacting that person's life.
Now, what are some sample answers that you typically get when you do ask patients these questions?
Some of them say, oh no, I don't want to leave my home because, I have my face is disfigured, or I have these lesions all over my body, or I am extremely itchy. I cannot sleep during the night. I don't want to exercise, or I don't want other people to see me. So in those cases, those are like red lights. We need to pay attention to those patients and say, hey, this skin condition is really impacting this patient's mental health. And it's time for us to address this and do something about it.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
I think, we have like millions of Americans suffering from skin diseases. So exploring the physical and emotional causes of diseases is the key for a successful treatment. And we cannot neglect how our emotional lives can affect the largest organ of the human body. And the field of psychodermatology is available to provide these conventional and complementary therapies with scientific evidence that will help you improve your skin health and beauty.
Well, thank you so much for educating us about this field and sharing your time and insight.
Thank you so much for having me today.